Hi, I'm Dr. Fredrick Echols, Acting Director of Health for the City of St. Louis. This week's public health questions are about COVID-19 vaccines and come from staff members at the William L. Clay Sr. Early Childhood Development Center on the campus of Harris Stowe State University. Question number 1. Do any of the vaccines currently being used under the FDA Emergency Use Authorization Authority have any negative impact on fertility? If you are trying to become pregnant now or want to get pregnant in the future, you can receive a COVID-19 vaccine. There's currently no evidence that any COVID-19 vaccines cause fertility problems, meaning problems trying to get pregnant. The Centers for Disease Control and Prevention and American College of Obstetrics and Gynecology strongly recommends that all eligible persons receive a COVID-19 vaccine or vaccine series. In addition, the American College of Obstetrics and Gynecology recommends that pregnant individuals have access to COVID-19 vaccines. If you are trying to become pregnant, you do not need to avoid pregnancy after receiving a COVID-19 vaccine. Like with all vaccines, scientists are studying COVID-19 vaccines carefully for side effects now and will report findings as they become available. Question 2. Are booster vaccinations necessary for the current COVID-19 vaccines authorized in the United States? There are still many particulars about SARS-CoV-2, the virus that causes COVID-19, that we do not know. Whether booster vaccinations will be needed is one such particular. The data is still not in on whether booster shots against COVID-19 will be necessary. Some drug companies have suggested that booster shots will be necessary, particularly with the rise of more infectious variants. Dr. Anthony Fauci, Director of the National Institute of Allergy and Infectious Disease, has also reported that individuals already vaccinated may need a booster vaccine in the future. He has estimated that may be necessary as soon as 8 to 12 months after becoming fully vaccinated. The City of St. Louis Department of Health will alert residents once a final recommendation is made by the Centers for Disease Control and Prevention and the United States Advisory Committee on Immunization Practices. Question number 3. If you have had COVID-19, should you still get vaccinated? If you have had COVID-19, it is recommended that you still get vaccinated. You should still be vaccinated regardless of whether you have already had COVID-19 because we do not know yet how long you are protected from getting sick again after recovering from COVID-19. Getting COVID-19 may offer some protection, known as natural immunity. Current evidence suggests that reinfection with the virus that causes COVID-19 is uncommon in the months after initial infection, but may increase with time. The risk of severe illness and death from COVID-19 far outweighs any benefits of possible natural immunity. COVID-19 vaccination will help protect you by creating an immune system response without developing COVID-19 disease. Both natural immunity and immunity produced by a vaccine are important parts of COVID-19 disease that experts are trying to learn more about, and CDC will keep the public informed as new evidence becomes available. Question number 4. Some doctors are telling individuals with underlying health conditions not to get vaccinated. Isn't it one of the main goals of getting vaccinated to protect those with underlying health conditions? The Centers for Disease Control and Prevention has reported that COVID-19 vaccines may be administered to most people with underlying medical conditions. Some people with disabilities might be more likely to get infected or have severe illness because of underlying medical conditions. All people with serious underlying chronic medical conditions like chronic lung disease, a serious heart condition, or a weakened immune system seem to be more likely to get severely ill from COVID-19. Recommended preventive measures for COVID-19, including vaccination, wearing a facial covering, and social distancing, are important, especially if you are older or have multiple or severe health conditions. If you have a medical condition, speak with your healthcare provider about steps you can take to manage your health and risks. Thank you so much for tuning in this week. I look forward to joining you next week for more critical public health information. Let me hear from you, St. Louis. Please send your questions to health@stlouis-mo.gov. Questions will be answered in the order they are received. If I run out of time on air, your question will be answered by return email. Be well.